Hello, Dr. Vicki Peterson here. I want to do this video today because there's something that continues to happen to individuals that is not okay. And I want to make sure that you know that you shouldn't let your doctor do this to you or anyone you know. Now that sounds pretty accusatory, and I don't mean it to sound that way. It's just that we live in an interesting time, medically speaking, in this country, and that is that doctors are a little bit between a rock and a hard place because they, by the rules and regulations, traditional medical doctors have to establish a diagnosis and then kind of after proving that diagnosis, then operate in a manner consistent with that diagnosis. So doctors are a bit diagnosis happy. Now listen to this story and tell me what you think is wrong, and then I'll tell you what I think is wrong. So a woman wrote to me today. She's been suffering with rheumatoid arthritis for a very long time. She chose to get off gluten herself and felt better. So of course rheumatoid arthritis is an autoimmune disease, and we know autoimmune diseases are highly associated with gluten, especially celiac. And so she felt better being gluten-free. And her doctor, after 6 months of her being off gluten, decided to run a celiac panel. So he did blood tests for celiac, and not surprisingly, of course, since she'd been off gluten for 6 months, the tests were negative. Now, was that a true negative? Who knows? It's definitely not going to be accurate when you've been off gluten, so maybe it's really negative, maybe it isn't. We don't know. So then the doctor said, well, now, since the blood is negative and the woman felt very strongly that she was gluten sensitive or gluten intolerant, of course doesn't know whether it's gluten sensitivity or celiac disease, her doctor has now put her back on gluten for many weeks, many months, and she's scheduled to do a biopsy. So there's several things wrong with this picture, not the least of which is that, well, as I said, she was off gluten for 6 months and did a test that, of course, is going to show nothing. Number two, the doctor is now considering, after having introduced gluten, which, by the way, she feels horrible having reintroduced gluten. She has brain fog, she has fatigue, she has headaches, she has digestive disturbances, she has reflux, and this was an email sent to me, and so she wrote, etc., ... So there were more things that the gluten caused. She just didn't mention all of them in the email to me. So she said, my doctor and I both agree that I'm definitely intolerant to gluten, but because of all the symptoms that came about since reintroducing it, but she's still several weeks off before she's getting this endoscopy, and she's dutifully listening to her doctor and eating gluten every day. So where's the problem in that? Do I get what the doctor's trying to do? Sure, he's trying to get that celiac label on her, and the only way he knows how. The sad part of this is that this woman is ill. She's much sicker since reintroducing gluten. The odds of her actually contracting another autoimmune disease, beginning serious diseases such as cancer, the list is very, very long, the things that can occur for her while she's eating gluten, which her body is screaming and yelling at her the only way it knows how, by giving her all these symptoms, telling her, please stop. She's already on some very serious drugs that have very dangerous side effects for her rheumatoid arthritis, which is not under control. Who knows what would happen if she really got off gluten and started to heal her gut. We certainly have seen that rheumatoid arthritis symptoms can settle down quite nicely depending on the individual and their case history, etc. But I've had patients on serious drugs like methotrexate, and the drugs that she's on do very, very well. But I digress. So what's the problem here? The problem is the doctor, who's a gastroenterologist, by the way, didn't know that she needed to be eating gluten in order to have an accurate celiac panel, and now is asking her to eat gluten and is doing a biopsy only, not redoing the blood test that now maybe could show something, especially if he included some gluten-sensitive panel like the anti-gliadin antibody. That might be a nice screen. But he's putting all his eggs in one basket and only doing a biopsy. The biopsy isn't perfect. It's not the gold standard anymore of diagnosing celiac disease. Someone can have a negative biopsy and still have celiac disease. So what is this poor woman going to be left with? So then, hopefully she's going to stay in touch with me or somebody like me that will tell her what she actually needs to do. And I'm not trying to sound elitist in any way, shape, or form, but this is a dangerous thing. I liken it to playing Russian roulette. When you know you're gluten intolerant and someone asks you to eat gluten and you do it just for the sake of a test, and then you feel terrible eating the gluten, what does that mean? It means your body is having a terrible negative reaction and you need to stop. And you don't want to continue for 6, 8, 12 weeks eating gluten just to do a biopsy that might be positive, might be negative. It's just not the point. We're creating more disease. I can't tell you how often, even in children, that I've had this scenario where other disease processes began as a result of that reintroduction of gluten. So for the same reason it's like Russian roulette when you cheat on gluten, it's the same kind of scenario when you're asked to reintroduce it just for a test. So what would I do with this individual? She already knows she's intolerant, and as she mentioned, her doctor completely agrees with her. We could do genetic testing. You don't need to be eating gluten in order to find out your genetics. Let's see what kind of genes she has. Does she have genes for celiac disease? Does she have genes for gluten sensitivity? Maybe one of each. I think that's helpful. Then you can start talking to family members because you know it's in your family and start helping others. But she knows. She already is very clear about the fact that gluten is not her friend. And now we're actually doing damage to her health. Further damage that she doesn't need and nobody needs. So as I said, I'm not trying to be a know-it-all. I'm not trying to chastise anyone. I think this doctor should have known that there was no reason to take a blood panel when she'd been off gluten for 6 months. But other than that, I do understand his viewpoint of trying to get that diagnosis, but it's just a dangerous way that he's going about it, and I wish more doctors knew that. So it's fine for you to know that and to make sure you don't fall into this category, because I just see it too often, and it's upsetting and it's dangerous, and I just don't want it to happen to you, and I don't want it to happen to someone in your family or one of your friends, okay? So please share this information with those you know, and let's just really try to get a grassroots movement on this type of thing, that reintroducing of gluten when you know you don't do well with it. There's never a good reason for it. There's other tests we can do to find out the answer, like the genetic panel. All right, so I hope you found this helpful. Let me know if you have any questions as always, and until next time, I wish you very good health.